Welcome to Gulf Coast Wellness. I'm Dr. Peter Shark, and I'm here to answer the question today, why can't my doctor seem to fix my digestive problem? I hear this a lot from people. So we have patients come into our clinic who have already been to GI docs, they've already had scopes, they've already been to the Mayo Clinic, they've been through a lot of diagnostic testing. Some of them have a diagnosis such as gastritis or IBS or delayed gastric emptying syndrome or food allergies or candida, depending on what kind of doctor you've gone to, you might receive one of these diagnoses. So once you have this diagnosis, why then is the problem not easily treated and remedied? And the problem is inherent in the way that conventional medicine operates. Conventional medicine is split up into specialties. And what it really means to be a specialist is to focus on one very small part and only look at that part. And that can be good for some things, but it doesn't work at all for digestive problems, gut problems. The gut is affected by many other systems, and the other systems need to be considered. So while your diagnosis may technically be true, you may have a delay in how long it takes food to empty out of your stomach. You may have irritation of your stomach lining or your esophagus or your intestines, but it is too small of a piece of the picture. So just think if your whole body was covered in a rash and you went to a doctor and they diagnosed you with wrist rash, and then they prescribed a wristband to treat your wrist rash, and then you couldn't explain why your wrist rash kept coming back. Meanwhile, the rest of the body is just completely ignored. That's pretty much what's happening with most people in their guts. They're being prescribed something that treats the gut directly, completely ignores the other systems, and never resolves the problem. So what's a better approach? The better approach here is to be holistic, to look at the entire person and all the systems and how they interact. Now, in order to do that, you have to have a superior knowledge of physiology. If you only know the basics, you're not going to understand how these systems fit together and affect each other. So one pretty simple example is the relationship between the nervous system, the adrenals, and the gut. So your nervous system exists mostly in one or two states, which is either parasympathetic, which is rest and digest, or sympathetic, which is fight or flight. And as the names imply, you cannot rest and digest when you're in fight or flight. So when your nervous system clicks into fight or flight, your adrenals go boom, send out a bunch of adrenaline, it shuts down the digestion, and then digestion can't happen. So if we have a patient with digestion not happening because of a nervous system dysfunction, but we're only trying to treat the gut, it's not going to work. Another example is hormones and gut bacteria. Studies have shown that your hormone balance can affect what bacteria are living in your gut, and the bacteria that live in your gut have a lot to do with how well you digest and use food. And when the wrong ones are in overgrowth there, you can have gas and bloating and diarrhea and constipation and irritation and pain and all of those types of things. So if the hormones are completely ignored, you could have a gut problem that's not responding to anything. And there are a lot of other examples that I could give. So in our clinic, we do things differently. Number one, we do a very thorough intake. We spend 3 hours with our complex patients doing intake. And anyone who has a digestive disorder is going to be complex because, like I've already said, there are usually multiple systems involved, and those systems and dysfunctions need to be identified. So the first step is doing a really thorough intake, going through the full medical history to understand all of what's going on. The second thing that we do that's a little bit different is we come up with a chief focus. So there are more kind of functional medicine doctors out there today that are trying to look at the bigger picture. However, they're frequently looking primarily through the use of labs and images. So labs and images still are just tiny bits of information. They do not pull back and look at the big picture. And the problem with that is that if you're going off only labs and images and you haven't done a thorough history and intake, Then you continue to try to treat the tiny pieces, just you're treating 25 tiny pieces at once instead of one tiny piece at a time. Whereas with a truly holistic approach, there should be identified a chief focus. So a chief focus is which pieces of this puzzle do we need to bring our attention to first in order to right the entire system? And that's really the treatment model that works well for these kind of complicated multi-system problems that often manifest in digestive symptoms. And that's the approach that we take at Gulf Coast Wellness. So if you're a person that's not getting good results with your digestive treatment right now, and you want a holistic approach that really treats the whole body to help you get better, and you're ready to make some changes to make that happen, we're probably a great clinic for you. You can go to the appointments page and it'll tell you how to contact us and what kind of information we need, and we will get you going towards your health. All right, I hope that answers some questions and helps some people out there, and I'll be back to see you again soon. Bye.